Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health.
Hello and good morning. Saturday, 27th of June, 2026, and welcome to the weekly health hour sponsored by CAN. Today, our topic of conversation is prostate cancer, what you need to know. And we're very honored, we're very pleased to have with us Dr. Eloka Okpalugo, who is, a GP trainee from Bexley in South London, and he's here to tell us, especially from a Black man's perspective, all that we need to know how to protect ourselves and how to access the available services to our benefits. So without saying much more, I'll pass you on to Dr. Eloka, and Doctor, the floor is yours.
Hi guys, hi. My name is Dr. Eloka. Thanks for the introduction. Just want to remind everyone that even though I live in London, I am from Manchester and I was raised in Manchester, so never forget that. Thanks for joining us all. It's a very important topic, prostate cancer, especially from a Black man's perspective. I'm just going to start sharing my screen so we can start the conversation. Okay. Okay, all good? Everyone can see that? Okay, so prostate cancer and Black men. This is for the Black community to know the risks. So why are we talking about prostate cancer? It's been in the news quite a bit recently. If anyone knows this man, it's Jeremy Clarkson. He's a famous British TV personality who recently told the news that he was diagnosed with prostate cancer and that he had treatment and he was back into remission. Now, it's got a lot of people talking about it, and it is a very important topic to talk about. It's the most common cancer in men. Around 58,000 men are diagnosed every year in the UK. Around 1 in 8 men will get prostate cancer. And if you're Black, the risk doubles to 1 in 4. It's the second biggest cause of cancer death in men in the UK. So let's talk about what actually a cancer is. It's a disease where abnormal cells are growing uncontrollably where they shouldn't. These abnormal cells, they build up and they can form a tumor. Normal cells, they usually regulate themselves and know when to stop growing. Whereas abnormal cells, they don't know when to stop growing. They keep dividing. They can spread into nearby parts of the body, and they can even travel to distant parts of the body. So these tumors that can spread, they're called malignant cancerous tumors. Okay, so not every tumor is a cancer, but types of cancers, malignant types of tumors are cancerous. So what is the prostate? So it's a very important part of the male reproductive system. Only men have one, and it's basically a gland. It's a gland is basically a part of the body that releases substances that the body needs. Like you may have heard of the thyroid gland, sweat glands, um, prostate gland. This releases fluid that helps to form semen, and this fluid helps the sperm to survive longer. It basically sits underneath the bladder, as you can see, and in front of the rectum or the back passage. So, how does prostate cancer start? Okay. The prostate is made up of millions of different types of cells. These cells are constantly growing, they're dividing, getting old, damaged, and they're dying. So normally this is a healthy, controlled process, but sometimes there's changes that happen in the cell DNA, and these can cause abnormal cells to just keep dividing continuously without stopping. So when these abnormal cells build up, they form a tumor. And so if the tumor stays inside the prostate gland, this is known as a localized prostate cancer. So as you can see here, just talking about the cancer staying inside the prostate. If it is an aggressive type of cancer, it can break through the prostate wall, spread to the bladder, the rectum. Then basically cancer as well, these cancer cells, depending on how aggressive they are, they can enter into the body's main transport systems, which is the blood vessels and the lymphatic vessels. Lymphatic vessels are basically like a drainage system that collects fluid from the blood vessels and from transports immune cells. There's lymph nodes that are very close to the prostate that prostate cancer cells can seep into. If these prostate cancer cells can seep into the blood vessels, the lymph vessels, they can spread to distant parts of the body. That's known as metastasis, which is a very advanced form of prostate cancer. It's most commonly, if you have this type, or if anyone has this type of aggressive prostate cancer, they can metastasize to the bone, spine, the pelvis, hips, things like that. So, is every prostate cancer the same? No, there's many different types of prostate cancer because there's many different types of cells. Prostate cancer, you can have some that grow very slowly, that would never spread, and they may never actually cause any symptoms. And there's others that are more aggressive and they grow a lot faster. They can spread outside the prostate and they can become life-threatening. So because there's different types of prostate cancers causing different types of harm, it can lead to difficulties with screening. So what's the cause of prostate cancer? So we don't know the exact causes of prostate cancers. Other cancers like lung cancer, liver cancer, these have very identifiable like causalities and links, like smoking for lung cancer, alcohol for liver cancer, things like that. But prostate cancer isn't directly linked to any like preventable risk factors. This means there isn't one thing you can do to stop yourself ultimately from getting it. But it's important to be aware of the factors that increase your risks. And fortunately, these are things that you can't change. So the biggest risk factor is age. Now, as we get older, our cells have more time to develop more damage. More damaged abnormal cells have more time to build up, divide, grow. And this can lead to increased risk of developing cancer. Most prostate cancers happen in men aged over 50 years old. Can happen below that, but it's very uncommon. If you're Black or you have a family history of prostate cancer, your risk starts to increase from a younger age, from around 45 years old. In the UK, prostate cancer is most commonly diagnosed in men aged 75 to 79 years old. So just because you're getting older doesn't mean you will get prostate cancer, but it does increase the risk. Now, ethnicity. Around 1 in 4 Black men will get prostate cancer during their lifetime. It's a scary fact. It's a scary statistic. And unfortunately, we don't know the exact pinpointed reasons as to why this is the case. Researchers think that it's a combination of different factors, genetics, family history playing a part, differences in access to healthcare. So, different attitudes, different ability to access healthcare. So there was actually a report by Prostate Cancer UK that say 1 in 3 Black men in the UK have negative attitudes towards the NHS. Again, the reasons aren't entirely clear, but it may be linked to, institutional racism, previous negative experiences, and all these things can make people of ethnic minorities avoid accessing healthcare. Also, awareness of prostate cancer. Not everyone is completely aware about how high the risk is in Black men, and delays in diagnosis. There's more research that is needed to understand why. Another risk is family history. So if you have what's called a first-degree relative, so that's basically mother, father, brother, sister, that's a first-degree relative. And in prostate cancer, if you have a father or brother who's had it, you're 2.5 times more likely to develop prostate cancer. Your risk may be even higher if you've got more than one first-degree relative, or if that relative was diagnosed before the age of 60. There are also other cancers that basically are linked to faulty genes. And if you have a family history of these cancers, so breast cancer, ovarian cancer, and pancreatic cancer, these can also increase your risk. Let's talk a bit more about the genetics without getting too complex. So, we're all made of DNA, of genes, and sometimes we can inherit faulty genes from family history. There's one gene that we all have, it's called the BRCA2 gene, and this usually helps to repair DNA in the cells, and that helps to regulate the cells to avoid them from turning into a cancer. Now, sometimes people have faulty versions of this gene, so it means it's not working properly, and it increases the risk of cancer over time. So if you have a strong family history of any of these cancers, prostate cancer, breast cancer, ovarian cancer, pancreatic cancer, it's like I'd highly encourage you to speak to your GP. They may refer you for a genetic assessment to see whether you have this gene or not. The other factors, so obesity. Now, being obese or overweight doesn't appear to increase the overall risk of getting prostate cancer, but there are studies that have shown that being obese makes it more likely that you develop a more aggressive type of prostate cancer. There's not entirely sure why, but it may be linked to difference in hormone levels or inflammation caused by excess body fat. Okay, so let's talk about screening. Now, what actually is screening? Screening is basically when you're testing people for a disease when they don't have any symptoms. So you're looking for the early stages, or if people have an increased risk of the disease. So when you're screening for cancers, the aim is to do it before symptoms and try and get like an early stage so that treatment is more beneficial. What makes a good screening test is to make sure that the cancer is detected early and reliably. The screening test does more good than harm, and it's got to be something that people are willing to do. So it's not too invasive and it's easy to access. So why don't we screen every man with prostate cancer? So the reasons why is like, unlike breast, bowel, cervical cancer, these cancers, these all have national screening programs, but these cancers have more reliable testing ways to help find early stages of the cancer. Prostate cancer, the screening tests that we have, they're not reliable enough to screen every single man. So this is where we talk about the main screening tool that we have. It's called the PSA blood test. Okay. So the PSA, it's an enzyme, basically, a protein that's made in the prostate that helps make semen more liquid.
Let's stop it.
Right. Both like prostate cells, normal prostate cells and cancer prostate cells, they also make PSA. So the PSA test can be a bit confusing. Now, because all men have prostate cells, then there will be a little bit of PSA in the blood. Now, if, say, someone has prostate cancer, then there may be higher levels of PSA because the prostate cells are producing more, the prostate cancer cells are producing more PSA. So this could be a sign of prostate cancer. However, there are other things that also increase the risk of, increase the PSA levels in the blood. So these are things like a urinary tract infection, recent ejaculation, prostate stimulation, vigorous exercise, certain medications, having an enlarged prostate, prostate infections, things like that. These can all also raise the PSA blood test in the blood. That's why you might hear if you're going to have a PSA test, you might hear your GP say 2 days before, don't ejaculate, don't do vigorous exercise, because that could kind of raise the levels of PSA and mess with the interpretation of the results. So screening can help find serious prostate cancer early and save lives, but you've got to be aware of the harms in screening and testing and things. So the advantages are, it can help find cancers early. It can help pick up the prostate cancers before you have symptoms. So if it picks that up early, then you can move towards having more efficient, effective treatment. You can detect and see if it's a very aggressive form of one, and you can kind of have treatment for it earlier, and it can, potentially save lives, and it does. They do save lives. But obviously you have to be aware that, as we said before, a raised PSA doesn't always mean that it's cancer. 3 out of 4 men with a raised PSA don't always have cancer. This can then lead to, if you've got a raised PSA, it can lead to more tests, more scans, more biopsies, which can be invasive, cause more worry, and can be painful. Sometimes you can find cancers that might not actually be that harmful. They may be one of the types that are very slow growing, and they don't cause too much, like they won't cause shortening of the lifespan or anything. This could lead to things like overtreatment, which again can have its side effects. So it's not a perfect test, because even then, there are some prostate cancers that don't actually produce that much PSA. So there's like a small percentage of people with a normal PSA that might still actually have prostate cancer. So the test, it's very useful, but it's not perfect. So who should actually have a PSA test then? The UK National Screening Committee, they have recommended that it's targeted PSA testing for people at higher risk. So I would recommend that you should speak to your GP about PSA test if you're a man and you're aged over 50, you're a black man aged 45 or over, or if you have a strong family history of prostate, breast, ovarian, or pancreatic cancer, or if you're known to have this BRCA2 gene. You should definitely speak to your GP if you're in any of these categories, which I'm guessing that a lot of people will be. Now, these are symptoms that I want everyone to be aware of. And if you have any of these symptoms, you should definitely go to your GP for a PSA test. Now, if you're having difficulty peeing or a weak urine stream, you should go speak to your GP. Blood in your urine or in your semen, needing to pee at night more often, if you're getting persistent back, hip, pelvis pain, problems with erectile dysfunction or unexplained weight loss, these are red flags. They don't always mean they have prostate cancer, but it's very important that you should get checked, because it could be a sign of symptomatic prostate cancer. So how does prostate cancer cause urinary symptoms? So when the cancer is, in the prostate gland, as we said, local, and it's advancing a little bit, it can compress on nearby structures where the prostate is. So as you said, the prostate is below the bladder, and it's got the tube called the urethra going through it. The urethra is where pee and semen comes through. So a prostate cancer can compress against the pee tube or compress against the bladder and lead to symptoms such as weak stream, so feeling like it's not as powerful, difficulty starting to pee, straining, stopping and starting, can lead to feeling like your bladder, like you need to pee a lot more, feeling a strong urge to pee strongly, and as we discussed, getting up at night to pee. Also feeling like you've gone for a pee and then half an hour later you feel like you need to go for a pee again because you've not fully emptied the tank. This is signs that prostate cancer could be pressing against the nearby structures. However, you need to be aware that there's other things that can also cause these symptoms that are more common. So most men will get this. It's called an enlarged prostate. It happens when they get older, when men get older, and the prostate can just grow and start compressing on, the urethra and the bladder and cause similar symptoms that prostate cancer might. Now, having a large prostate does not mean that the prostate is cancerous. It doesn't increase your risk of getting prostate cancer, but it can coexist with prostate cancer. So if you go to a GP, how does a GP do a prostate check? First, they'll start off by asking about the symptoms that you're getting. Then, ask about your family history, take your age into account, take your race into account, and, look and ask about any red flag symptoms. They may then arrange the PSA blood test, do what's called a digital rectal exam, and do a urine test. Now, the digital rectal exam, this is an important part of your prostate check. So you've got the PSA blood test and the digital rectal exam. It's basically, it's where the doctor passes the finger through the back passage and kind of feels the prostate, and they will assess whether the prostate is normal size, normal consistency, it feels normal. So prostate's about the size of a walnut, usually smooth, and your doctor will be feeling to see if it's too big or if it's too hard, if it's irregular shape, lumpy. That would be signs of prostate cancer. So our digital rectal exams, they're quite important because it can help to differentiate between having a large prostate, which can also raise PSA, and prostate cancer. Okay, it's obviously it's not the most comfortable of examinations, but it doesn't take very long, and it's not painful, and it's, as I said, quite important because there's a small percentage of people who will have a normal PSA and they might still have prostate cancer. So I would encourage, it's not compulsory, but I would encourage people, especially with higher risk, to, if a GP says we need to do a digital exam, I would encourage to do it. So if PSA is raised or is an abnormal prostate examination, what happens then? So your GP will refer you to a specialist urologist under what's called the urgent suspected cancer pathway, also known as 2-week wait for some people. The aim is to kind of get the patient to have a diagnosis or not a diagnosis of cancer within 28 days. That's the aim. We still it's the NHS, so sometimes it might take a longer, but the aim is to do all that within 28 days. So they'll refer you urgently for a urology appointment where, again, you talk about your symptoms, review you again, and they may say, okay, let's do an MRI scan. This is to look for suspicious areas in the prostate. And they may say, okay, look, you might need to have a biopsy. Now, a biopsy is where it's quite invasive, and they use a needle to take samples from the prostate. And And it's important because it helps to find out what type of prostate cancer, if it is prostate cancer, it is. They sample it and then they send the cells off and to see whether if it's one of the slower growing, low risk ones or whether it's the more aggressive ones. Now, without going too much into it, there's different stages of treatment. If it's lower risk, the urologist might say, we don't need to do any surgery, radiotherapy, or anything like that because it's very slow growing. What we need to do is what's called active surveillance. So we regularly test you, check your PSA level, see if it's rising or falling. Initially, like every 3 to 4 months, they'll check your PSA. You'll have regular MRIs, maybe every year, things like that. And some people might have repeat biopsies to see if it's become more aggressive or not. Then the more aggressive the tumor is, the more options for treatment. So if it's localized, the aim of treatment is to actually cure it, so either by surgery or by radiotherapy. And as it becomes more aggressive, there's other ways to try and help cure it by using hormone therapy as well, radiotherapy, possibly surgery. But if it is metastatic and if it's spread far distant to the bones, even the lungs or the liver, then the aim is to control the disease to reduce the spread and prolong life rather than to actually cure it because it's spread so far. So how can I reduce my risk of getting prostate cancer? So there's no guaranteed way, but there are ways to kind of help reduce the overall risk of developing an aggressive form of prostate cancer and cancer in general. So these are very important ways to just generally be cancer-free. So no smoking. It's very well known that smoking is linked to a lot of different cancers. It's not directly linked to prostate cancer, but smoking increases the risk of cancers. So stop smoking. I would encourage you, if you do smoke, to stop smoking. Keep a healthy weight. As we discussed, obesity can be a risk factor for getting more aggressive forms of prostate cancer. So that's eating healthily, getting regular exercises, things like that. Also, as well, drinking less alcohol, being safe in the sun, using sun cream, eating a high fiber diet and cutting down on processed meats. These are all things that you can generally do to reduce the risk of developing cancer in general. So in terms of diet, eating healthily to try and keep a healthy weight and to also avoid what's called carcinogens, which are things that can increase the risk of getting cancer. So, eat a healthy amount of fruit and veg, at least 5 a day. Whole grains, so like brown bread, and healthy amount of good proteins that you can find in beans, fish, nuts and seed, chicken, turkey, and drinking plenty of water. So aim to eat less of processed meats. Now, ultra-processed food, ultra-processed meats, they are strongly linked to bowel cancer because it is quite high up on the carcinogen list. So it may also increase the risk of prostate cancer. More research is needed to see if it's directly linked, but I would definitely reduce having too much of bacon, sausages, ham, salami, and pepperoni. If you like your red meats, that's okay. It's okay to have it in moderation, but there is some evidence, not a lot, but there is some that it may increase the risk of prostate cancer. So aim to eat no more than about 3 portions a week of beef, pork, lamb, things like that. Also, as well, if you like a barbecue, try and reduce having too much barbecued burnt food. So, should I take supplements or herbal remedies? Common thing that sometimes I see in clinic with prostate cancer is people, from Africa or Nigeria go saying, I don't want to undergo any treatment, or I don't want to go through any um, like assessments and things because I had some herbal remedies, some natural remedies that have been shown to reduce that have been said to reduce my PSA, reduce the size of the PS of my prostate cancer, etc., etc. Now, there is very little as evidence that herbal remedies help to prevent or treat prostate cancer. Um, and also as well, some herbal remedies can interfere with medical treatment. Now, I'm not saying don't have herbal remedies. Western medicine isn't the end all be all. There may be different types of herbal remedies that may help different people. But what I'm saying, there's very little actual evidence that it does on a grand scale. And you shouldn't be taking this instead of taking medicine that is, advised by urologists or anything like that. If you are taking any supplements or herbal remedies, it's important to let your GP or your urologist know that you're taking it, just to make sure it's not interfering or interacting with any other medication that you might be having. Now, the future. Okay, we just talked about how the risk of prostate cancer is so much higher in Black men. What's actually been done about it? So the UK is undergoing a trial called the Transform trial. The government's invested a lot of money into this to try and find more accurate ways to screen men, including Black men, for prostate cancer. So they're inviting thousands of men across the UK to take part. They may compare the tests that we have, PSA blood tests, MRI scans, look at DNA tests to try and find out what's the best and safest way to screen men. And as we discussed, like, the risk is so much higher in Black men. So this trial is trying to focus and get a lot more Black men into this trial to find Black men who are affected and how we can do better. We can develop better screening methods to try and help save lives. Okay. So take home messages. Main things that I want everyone to know is that you, as a Black man, you should know that the risk is higher of getting prostate cancer, and even higher if you have someone with a family history. Okay. You should know the symptoms. So as we discussed, if you're noticing any changes in your urine, finding it harder to pee, peeing a lot more, any blood in your urine or semen, persistent back, hip, or pelvic pain, unexplained weight loss. Make sure you know these. If you're getting any of that, please go and speak to your GP, get a PSA test and a prostate check. And if you're Black and over 45, as we discussed, please go speak to your GP. Okay, so please, please, please don't ignore persistent symptoms. There's a habit of some people with symptoms to try and like suppress it, especially amongst men, to be like, oh, it's fine, I'll soldier through it. It'll blow over. Please don't ignore persistent symptoms. Speak to your GP if things like this come up. Also, I want to encourage just talking about prostate cancer, the risk of prostate cancer in Black men, with family members and friends as well, just to get conversations going, just to kind of reduce the fear of going to get investigated for it, because these early conversations can save lives. So yeah, I would definitely encourage as well Black men to go to Prostate Cancer UK, the website, and open up the risk calculator. It's a very good tool, and if you put in, it asks you some questions, and if you answer them correctly, it will encourage you to either go speak to your GP, tell you about different facts about prostate cancer, etc. Okay, thank you guys. I hope it was understandable, and yeah. I think we'll go over to Michael for questions.
Yes. Thank you very much, Eloka.
No problem.
Thank you for what has been quite a comprehensive um, journey through the whole prostate cancer um, landscape. Now, there's a few questions that are coming up. But before we get into that, can you kindly give us a small recap of the red flags and also maybe some indication of how we can pick up prostate cancer uh, symptoms and or signs really in the people around us, and maybe a little bit of advice on how we can tactfully engage the subject, because there are quite a lot of men who are not a bit headstrong when matters like this are
Yeah.
approached. Are there any um, resources that you can tactfully drop into a friend or brother's WhatsApp that can prompt them to take a more serious look at this?
Yeah, yeah, okay. So the red flags that we're talking about, um, so the urinary symptoms are feeling like you need, this is in older men as well, in black men over 45, feeling like you need to pee more frequently than usual, feeling like you've got a sudden strong urge to pee, and it comes on really quick and hard, um, feeling like when you're peeing, it's not as strong as it used to be. It maybe dribbles. You're peeing and then you're stopping and then you're going and you're stopping and you're going. Um, you know, feeling like you've not completely emptied the tank. You've gone for a pee and you still feel like there's more left, but you can't carry on. Um, these are the symptoms. These are urinary symptoms that you need to go to speak to your GP about. As I said, it could be other causes, but if it's prostate cancer, that means that it started to advance and compress around the bladder and the pee tubes. So it's important that I get screened for it, like now, to either catch it or rule it out. Then other red flag signs are blood in the urine or semen, um, bone pain, specifically lower back pain that's persistent. It's been going on for some time. Sometimes it might be so bad it wakes you up at night. Um, hip pain, upper leg pain, things like that, because these are the bones around the prostate that prostate cancer cells can spread to. So lower back pain that's persistent, lower pelvic pain. Also, as well, if you're having difficulties with erectile dysfunction, again, there may be other causes for this in older men, but prostate cancer can affect some of the nerves around the area. So it's important to get that checked out. Also, as well, getting up at night more often to pee. Getting up at night to pee once is like okay, but if it's like 2, 3, 4 times, you're like, oh, something's going on. What I keep is disrupting my sleep. You should go speak to your GP about it. And yeah, noticing it in other people. It's a good question. I mean, if you notice that your friend or your partner who's like, older black man pees a lot, goes to the toilet a lot, maybe you're hanging out with them and they're constantly going toilet break, restaurant toilet break, out for drinks, toilet break quite regularly. Maybe something to just flag up and say, hey, like you've been going to the toilet quite a lot. And be sensitive, but don't be too sensitive. Just be like, what I would say is just be like, you know, as a black man, the risk of getting prostate cancer is higher. 1 in 4 black men in the UK will get some form of prostate cancer, and it can be aggressive. So it might not be the cause, but because of the risk, just speak to your GP about getting a blood test, getting checked. And if it's your partner, you can say, I can go with you, you know. Sometimes you can even, I've had this before where someone has booked the appointment for their partner and the partner's turned up. And yeah, just encourage conversation around it, even when you don't see symptoms. So, you know, if you're just having everyday conversation, I mean, not saying you should just drop it in and say, hey, let's talk about prostate cancer, but I mean, it's, you know, when you get around and you're talking to your boys, you can talk about, hey, did you know about the risk? They're so high. A lot of black men might know someone, a lot of black people in general might know someone who has been affected, or families who's been affected by prostate cancer, or friends who's affected by prostate cancer. So just, you know, you can bring that up in conversation, like, how's this person? I heard this, things like that. The more we talk about it, the more we bring it up, the less people will be embarrassed to talk about it, you know, embarrassed to talk about going to pee a lot, things like that. Just need to raise awareness. So yeah.
Okay. Thank you. Thank you very much, Eloka. I've got a few other questions for you. Now, um, this one is saying, what can be advertised to encourage men to visit their GPs? I mean, what do you think is the best way of putting the message across? Or are you aware of any um, resources that we can use in our other community groups
Mhm.
and encourage men to go to the GP? And
Mhm.
also add to this, are you aware of any advocacy for early screening? I mean, one of our friends this morning is wishing that screening could start at 35 for those with family history, or perhaps even for all men, because too
Mhm.
many people are diagnosed too late.
Mhm. Mhm. So yeah, to answer the first question, Prostate Cancer UK, the website, has really good materials, kind of summarizing the risk of prostate cancer, and they have PDFs and leaflets, specifically for you know, the Black community, that you can, if you're a community leader or a part of a community, you can kind of get these um, leaflets, and you can just kind of leave that. You can ask different areas like shops or something, that where you can put the leaflet up on the windows, things like that. Community groups, you can just hand the leaflets out. Churches, you can, you know, have the leaflets, hand them out, put them up on boards, things like that. Um, that's quite effective. Um, I think maybe the strongest tool that we have is the media. Um, a lot more people, a lot more men went to see their GPs after finding out that Jeremy Clarkson had um, um, prostate cancer. Um, you know, there's a lot of, you know, big black celebrities who kind of champion the cause of prostate cancer, and they, like, either through the news, you know, have lots of campaigns to encouraging black men to, um, not just black men, all men, but specifically black men, to go speak to their GP about that. So I think the best way is probably through the media, getting more, you know, notable celebrities to talk about it, especially black celebrities. Um, Also, as well, you said about advocacy for earlier screening. Now, I know that with this trial, the Transform trial, I think the aim of that is to try and find out the best way to, what is the best times, the best ages to start, um, to start screening for black men, because, as I said, black men have tendency to be diagnosed with prostate cancer earlier. I'm not aware of any like specific campaign groups to trying to champion this cause. I just know that recently the UK National Screening Programme released saying that the screening test we have isn't as reliable to do screening on all men, mainly because in the long term of things, they may cause more harm than good for a national screening program. So that's why they've encouraged targeted screening. But through this trial, they're putting a lot more money into the research to try and find better screening methods so that they can in future be a national screening program, basically. So yeah.
Okay. Thank you. Thank you. I hope that explains things for many of us, for all of us, really. Now, digital rectal examinations. Now, are they routinely required in these days, or has the shift or has the emphasis shifted to MRIs? And when you have an MRI scan, will it routinely show the size and spread of the prostate cancer? So basically, the question is it more is the emphasis more on digital examinations or on MRI, and what are the comparative advantages of either method?
Okay, so yeah, digital rectal exam, it's more of a tool, say if you're going to a GP. GP won't have an MRI in front of them. And also because of reasons discussed with the PSA test, it could be raised due to other reasons. It's important. It depends on who you ask. I know for me, I generally say we'll do PSA, and if you're okay with it, we'll do a digital rectal exam. Because if you do a digital exam and you find that the prostate is like irregular size, if it's jaggedy, if it's lumpy, hard on the prostate exam, then like you gotta go straight away to urologist. Now, if you're getting in front of the urologist, then MRI is more heavy on that side. Yeah. So yeah, I would say it depends. Some people don't do it, but I know generally I think that it is encouraged to do a digital rectal exam as well. MRI question. So what the MRI does, they've got it's called multi-parametric MRI. So it takes loads of different MRIs from different angles, and it can show areas that look suspicious of a cancer, yeah, in the prostate. And then with those images from the MRI, it can see how big it is. It can see if it's, touching the prostate gland walls. It can see if it's gone into the lymph nodes that are around the area more locally. Now, if it sees this, the MRI, you may, get sent for a biopsy to check and see how aggressive it is. And you may also be sent for a different scan. If it is quite an aggressive one, you might get sent for a PET CT scan, which will do your whole body and check and see if there's any signs of prostate cancer anywhere else in any other organs and things like that. So yeah, the advancements that we've had in MRI has been really helpful in trying to determine, where prostate cancer is, how far it's gone, things like that. And I think it has also kind of helped to reduce the amount of need for biopsies and things like that. So yeah.
Okay. Now, the risks that you mentioned, are they for Black men all over the world, or are they just for men in the UK? And also, talk about ADT injections. Are these accompanied by a regular PSA check?
Okay, so Um, with what was the first question again? Sorry.
First question was a very almost yes or no question. The risks that you mentioned, are they universal for
Oh,
Black around the world,
yeah.
or are they just for UK
So,
Blacks?
so from what I understand, the general risk of prostate cancer all over the world is 1 in 8 for men, and in the UK, it is 1 in 6 for men. Um, but the risk of Black men is 1 in 4. It doesn't decrease. So, from what I understand, it's the same risk all over, 1 in 4, from what I understand. But I haven't looked directly into the figures and compared it with the worldwide one, basically.
Okay. And then
And also, yeah, okay, the injections, I'm not entirely sure. I think they should, um, just to kind of see if the PS, because generally if you have been diagnosed with prostate cancer and you're getting treatment, then there is regular PSA checks to kind of see how far it's going down, if it's increasing, So you need to check and see if the hormone, if the injections are working or not, basically.
okay.
So,
Now, somebody also says this question is that is there any reason just a minute. Um oh sorry, sorry, sorry. Um yes, is there any reason why the GPs are not automatically inviting men over the age of 50 to conduct the test? Very much,
mhm.
very much the same way as smear tests are done for women. And also, how often would you recommend that the test be carried out for over 50s? Every year, every 2 years?
So yeah, I think because there's no national guidance and no national screening for prostate, that's why GPs aren't sending out to every um, man over the age of 50. Um, because of, screening, if we were to screen every single man over 50 for prostate cancer now with the screening tests that we have on a grand scale, it could lead to a lot more harm than we would like. Um, you know, I can't remember the numbers exactly, but I think if you were to screen 1,000 men for with the PSA, you would kind of right now with the PSA test we got, you would save 2 lives. So if we were to increase it so then there's other people in those 1,000 men who've gone off and had biopsies, found cancers that may be very slow and not cause as much harm, and have had some form of treatment, which all these things come with side effects. Biopsies, because it's quite invasive, there can be risks of recurrent infections. There can be risk of, because you're going in that area where there's nerves that there's blood vessels, there's nerves that deal with maintaining an erection. It can lead to erectile dysfunction. In small, rare cases, biopsies can lead to something called urosepsis, which is basically like where you get a bacterial infection that's so bad it starts to go around in the blood, and it's very serious. So if a national screening program was done on a large scale, then I think the worry is that the harm that's caused might be a bit too much. That's why they're putting so much more research into it, because they are aware it's like such a common cancer. But it's just the testing, the PSA screening testing isn't reliable enough. Whereas like smear tests, breast cancer tests, things like that, these tests are more reliable, and it's found, like, for example, the smear cervical one has really reduced the amount of cervical cancer in women in the UK because the testing is so robust and it's so it's well done. So the aim with more research is to try and get screening methods, tests as well, so it can get to a higher standard. So it causes more good, saves more lives than harm. But if you're over the age of 50, and obviously this is the thing. This is the thing. That's why it's not a national screening program. But you still need to know your risks. You still need to know that as a black man, you're at higher risk. And just because there isn't a national screening program, doesn't mean that you should say, I'm not going to do it because the government hasn't told me to do it. No, I think it's where you kind of advocate for yourself and you say, I know the risks and I want to go and speak to my GP about it. So then you can have a discussion about one, the other risk factors, family history, genetics, things like that. And then take into other account different things that could be, whether it's a UTI, whether it's BPH, things like that. I think so if you're over 50, I'd say every 2 years is good. Every 2-3 years. As a black man, you should start earlier, 45. So, yeah.
Okay. I think we're running out of time now, but just a comment from myself. Do we have a situation, for example, where a black man over the age of 45, say 50, has a right to walk to his GP and ask to be tested for prostate cancer?
Mm-hmm.
We do. So we can all go and insist that we want a prostate cancer test
So
and do not.
I wouldn't say insist,
Mhm.
because then it's like you're going there and you're demanding for a blood test.
Almost
That
politely.
okay. So I wouldn't say you go and you're like, hey, listen, because I'm black, I need a blood test. I think you have a right to go and speak to your GP and have a conversation about having the blood test.
Okay.
Now, you have this discussion, you and your GP will talk about the other risk factors. Yeah. Family history, as I discussed, genetics and things like that. Because this will all be taken into account to see whether a PSA to screen for prostate cancer is good for you or not. So, sorry, just to reframe, you don't have a right to say, give me the blood test. You have a right to say, let's have a conversation with the same energy.
All right. Now, there's a question here which I've been having trouble understanding, but it says, if the government decided not to target black men, what is the likely response to men when they approach their GP outside of BRCA2? I am thinking about black men younger than 50 that don't have symptoms.
So if the government's saying don't target, I'm not sure. I'm not sure what you mean.
I'm not sure what the individual means. Please, if you're still with us, can you rephrase your
Yeah.
question so that we can look at it? We'll spend the next couple of minutes waiting for this. And then I think, yes, some of this. Do you know at what stage the tests can distinguish between the harmful and not harmful prostate cancers? Is there anywhere globally that can detect this early?
Oh, I wish. That's why the government's funneling money into trials to try and find this. There's lots of research, more research that needs to be done. There needs to be more research funds put towards this. But the the earliest test that we have to see if it is more aggressive, I'd say, is with the MRI, because then you can see the growth and see if it's gone beyond the localized area we talk about. So if it's gone beyond the prostate, then the MRI can show that. That's the earliest test. But you still need to have a biopsy, because the biopsy takes the cells and looks under a microscope at the cells to then analyze and say, oh, this is like a really aggressive type. This isn't. So yeah,
Right.
that answers.
eventually, you see, you can't talk about issues that affect um, great swathes of the people, broad masses of, oh, sorry, my watch, masses of the people without entering into the political side of it. Now, in your estimation, do you think that prostate cancer is being given enough priority nationally, or do you think that there's a good argument for a political organization to force the Department of Health or the government to pay a bit more attention to um, prostate cancer? After this question, I shall look out for that earlier question. And if it's here, yes, we'll look at it. Otherwise, then this will be the last question.
Yeah, I think is there enough? No, I think they're starting to be, because I think that once more of a certain demographic speak up more about it, then there'll be more attention. But I think, yeah, definitely more can be done. Without trying to sound too political, um, I think, yeah, there isn't enough. More could be done, and I think we're in the process of doing more. Things will speed up as more people talk about it. Um, Obviously, it affects black men a lot more. More black men will talk about it, but also as well, it affects white men as well, and more white men should also talk about it. Like, for example, it's a shame that it's because this is the way, but there was GPs. I'm not sure the exact numbers, but GPs um, reported more men coming asking about PSA checks after they heard about Jeremy Clarkson. Um, Obviously, if there's more pressure on the healthcare services, that translates to the government. The government says, "Oh, this is more a concern." They put more money. So yeah, it's all about how much noise that we can make, I think.
We don't want to go on a million-man march, for example, for prostate cancer, not just yet.
And not just yet, but I feel like we should talk more. We should definitely encourage. I think to be honest, I think the attitudes toward prostate cancer is definitely changing, especially within the Black community, which I think was amazing having more Black men come and speaking about their risks, certainly in clinic with me. So I think we're heading in the right direction, and we just keep making noise about it. Things will happen
Today,
fast.
yeah, today's health talk is experiencing something that is slightly unusual. This time, the attendees are having the conversation in the chat,
Oh
which is
no,
quite nice.
I'm
But
scared.
there's
Hopefully, good things.
there's well, some of them are answering your questions for you.
Oh,
So
brilliant. Thank you, guys.
yes. So there's one here which I think I deserves to be read out. It says, "Hi everyone. I think it's very important to advocate for the men in our lives, especially when we know black men generally don't like to worry about their health and visit the GP. So wives, girlfriends, partners, and friends, like the speaker said, we all have a big role to play in early detection." Yes, kudos to you. Congrats for putting that in. And then I think we're running out of time now, but what about the links between andropause and prostate cancer? Are changes to our hormones? And it says, another one says, question, high testosterone in young black men under 40 suffering with symptoms of prostate cancer. Would the doctors do a test even if no family members have cancer? The problem I see is if they are if they're left behind and in their 50s now being diagnosed with stage 4 cancer, etc. Then he says, thank you, doctor. So, final comments from you, Eloka, and then we will pass on to Mr. Sam for closing from Khan.
Yeah. Final comments. Yeah. If you're black and you're over 45, go speak to your GP about PSA checking, PSA testing. especially if you got symptoms. It doesn't mean that you might necessarily need to have a test, but at least you're having that conversation, you're going, you have that, and your GP may decide, yeah, you need a test, things like that. GP might decide, no, you don't actually, we've looked at the risks. So, sorry, I'm rambling, but basically, talk about it, talk more about it, make more noise amongst your friends, family, things like that. That's how we kind of get this research to move faster
Any links
and
between
encourage more people.
andropause? Any links between andropause and prostate cancer?
Andropause.
Yeah.
Oh, good question. I'm not sure. I don't know. Is there any urologists in the chat? Any urologists in the chat? Help, help. Refer to urology.
Right.
I'll ask for advice and guidance from any urologists, and we'll get back to you within 48 hours.
Right. So thank you very much, Dr. Eloka. Thank you very much for
No problem.
the interest that you take in the health of your brothers and sisters. I will now pass you on to Mr. Sam Okerenta from Cannes, who will give us closing messages from Cannes. I'd like to personally say thank you very much to everybody for attending. This is has been a very important, well, it remains a very important subject for Black men and men's health. And thank you, Khan, for considering this. Sam.
Yeah, thanks for attending, everyone.
Hello, everyone. Good afternoon. Thank you very much for joining us. And I just want to reiterate what Dr. Michael and Dr. Eloka said. We do appreciate the time you spend with us on Saturday mornings, the regulars and the new people that are joining us for the first time across the platforms. It's been a wonderful session, a lot of interaction, a lot of key points were raised, and hopefully this reaches the right audience. And, Black men are encouraged more to take care of their health. And if they have any symptoms, do get checked out because it's important. We don't want to be a statistic of 1 in 3 of us dying, which is quite scary to think about. So I'm just going to quickly share my screen, talk about quick things that's happening here at Cannes. If you just bear with me. So next week we'll be here again, same time, same place, same link. Share it with your friends and family. Another health hour session. Look out for more information on socials. If you are a doctor that wants to get involved, do contact us. If you are a healthcare professional who's interested in hosting, do contact us. If you have topics that you want to inform or want to be more informed of, please do email us at info@cannes.org.uk. We'd love to hear from you. Quickly going on to the next slide. Oops, missed the slider. In just about a week, just about a week, on the 4th of July, we'll be celebrating our wonderful Black healthcare professionals here in the UK. If you've never been to any of our events before, or you've never been to a Black Healthcare Awards, it's a fantastic event. We've had about 2 of them now. This will be the 3rd iteration. And the last 2 we have sold out with over 500 people attending. And it's important that, Black healthcare professionals such as Dr. Michael and Dr. Eloka and many others that have helped us in Health Hour or during various programs or things that we have going on at Cannes are celebrated, and those outside of Cannes as well are celebrated, because we do have Black healthcare professionals, whether you're a laboratory technician or a researcher, or you are out there educating the next generation of healthcare professionals. We do think it's important that you are celebrated and you are honored for the hard work that you do and the dedication that you put towards our community, because every little thing that you do, you might not be seen in your workplace, you might not be appreciated by those around you, but do know that the work that you're doing does have impact in the lives of us and the generations to come. So we do appreciate that. So if you are interested in attending, it's going to be a 3-course meal. It's going to be live music, lots of performances, opportunity to network with other people from different fields, and you might meet your friends there that you didn't know were going, or you might meet your friends there that you know that you're going, and you all sit together and have a great time to celebrate together. So please scan the QR code and purchase a ticket or a table. If you want more information, please do contact us at Black Healthcare Awards at cannes.org.uk. It's going to be a wonderful evening celebrating. I've got my outfit ready. I just need to get a haircut and my hair ready, and I'll be ready to celebrate alongside the rest of you that will be attending. If you are interested in taking part in research, we do have a quick survey where you can take part in understanding how social media and how you understand health through the use of social media. So we do know that there's a digital age, lots of people on social media, whether that's TikTok, Facebook, Instagram, LinkedIn. We do know that people come across lots of information on there, and sometimes it's hard to discern what is real, what is factual. So that's why this survey is going to be available. If you scan the QR code or you email research@con.org.uk for more information, just to be able to understand and share your views on ideas on how you can help shape more inclusive research, because we want research to target our community and, we get the right feedback, the right information from the right people, instead of a lot of AI slop, as they say, out there, which could be quite misleading and provide a lot of misinformation when it comes to health and other factors that could affect us as a community. As you know, this month we celebrated Windrush. We celebrated Windrush at Alexandra Park, and it was a wonderful experience. We had lots of people there. I think we had about 5,000 people there celebrating alongside us here in Manchester. I think one of the best Windrush celebrations we've had so far. And from that, we know that a lot of things have happened to the Windrush generation, which has been deemed very unfair. And personally, I didn't know much about Windrush till I started working at Khan. And, as my time here, I've been working at Khan, learning much more about other communities, not just the Nigerian or African communities. And the injustice that the Windrush community have faced has been quite stark. So that's why we teamed up with the Home Office to help get people the right compensation. We do hear stories of people, being sent back home or not being allowed to come back into the country due to paper issues and all these other things that could be quite easily sorted out if they had the right support or if the right legislation and laws were put in place. But we decided to work with the Home Office because we want to make sure that our community get the right help and get the right support that they need. So as you can see here, there's a QR code. Feel free to scan it. More information can be found on our socials or our website. And also, if you do have really key information, please email advocacy@con.org.uk for support or for more information. It's quite important that if you know someone within the Windrush community or someone that falls within that space, whether you're a descendant of someone from the Windrush community, please scan. There could be some support there that's available for you and your family, those around you. So please do share this. This is quite important. And we do hope that we do hope that those people that get the help that they need would feel some sort of satisfaction from, the injustice that was felt from those that have experienced a lot of pain, because we have come across a lot of people that have felt that pain, and it's quite heavy on the heart. So please do scan this QR code and take part in filling out the form, and we'll be in contact. If you are based in Enfield, we do have a upskill opportunity for those in the healthcare space. It's called the BHIP program, the Black Health Improvement Program, where we'll be able to educate you and your staff members on how to be a bit more culturally appropriate. Some people from our community, whether it's their first time in the UK or they've been here for a while, have ingrained cultural factors that make them who they are. For example, sometimes people in our culture, in the Black culture, won't be able to look a healthcare professional in the eye when they're speaking to them about their certain issues, because they feel like it's a sign of respect. And some GPs or some healthcare professionals might misinterpret that as they're shy or they're timid and not understand the nuances that go on within the Black healthcare, well, within the Black community. So that's why we have provided this program here, where you'll be able to sign up and help your staff members get educated. There's a tier system starting with bronze, silver, and gold. So obviously, at the higher up you go, the more it shows that you are more culturally competent to handle cases or handle people within our community, which is quite important for making people feel reassured that they're getting the right help from the right people, which is very, very important. So do please contact us at enfield@con.org.uk for more information or to sign up your practice. This is based in Enfield, and this is for the Enfield borough. I know this is quite niche, but if you do know someone that could benefit from that, please do share this with them. Black Health Improvement Framework. So as I've been saying, a lot of the work we do is for the Black community. So we decided to create a very important framework that helps not just ICBs, not just organizations, but everyone that has to deal with our community. Strong 5 pillars that can, ensure that once they align themselves with these pillars, with these pillars, that they'll be able to get more out of our community in terms of a collaboration aspect, in terms of working better with Black people, understanding the Black experience. So I'll just quickly go through the 5 pillars so you can get a bit understanding of the kind of things that you would find within this framework. It's available at www.apbgblackhealth.uk/resources. The first pillar is culturally appropriate service. That's something that we do believe it's very important. Having the right people in the right spaces to provide a service definitely goes a long way in understanding the people that you're dealing with. The second pillar is community leadership, co-design, and co-delivery. A lot of the work that people do for the Black community is done by people outside of our community, trying to understand us or labeling us as hard to reach, which isn't necessarily true, and it kind of does have a negative effect because we're not hard to reach, we're accessible, we're eager to do the work with you or eager to do the work alongside you to understand what you want to achieve. And, understanding community leadership is important because we are very community-centered people, and this is how we operate, this is how we've been taught to operate. And to get the best out of people, sometimes you have to embed yourself in their culture to understand. So that's the second pillar. The third pillar is inclusive research and ethnicity data collection. As I said earlier on, we know that things are out there online that's a bit misinforming, that has a lot of misinformation, and that, kind of puts people off developing on the information that they get. But if you are able to include us in this research, it's easier to, ensure that Black people feel comfortable in sharing their data, or sharing a saliva sample, or sharing their blood. Obviously, we do aware that we've had some cases in the past where our data has been used incorrectly, or our DNA has been used to do all sorts of things, and that's unfair and that's incorrect. But it's important that inclusive research is at the bedrock of every research that goes out to the public, because when you do research, you're not just doing it for one demographic. When you create a drug or a treatment or a service, it's not just for one particular group, it's for people of the whole world so that they can access that and get the best out of it. The fourth pillar is workforce and system leadership. So it's quite self-explanatory. I won't need to go into much detail. Black people need to be able to have the opportunity to be pushed higher up the ladder. That way that they can help other people. And it's just important to see people in high spaces and have some aspiration to look up to. I won't really go much into detail. That's quite self-explanatory. And the last pillar is transformative cultural education and training. Again, very, very to the point. These pillars are, funded by and supported by the Health Foundation. They worked with us closely. We've been to the Parliament, we've had discussions, we've had lots of engagement with the community. And over the last 10 years of CALM's existence, this has been one of the things that I've been working towards, and we're glad to have achieved it. And it's now out there for people to use. So if you do want to be in contact with us, please contact us as appg@calm.org.uk, or just visit the website on the link or on the screen, sorry. I just want to say again, thank you very much for joining us on this Saturday morning. We hope that it's been beneficial to everyone here. And if you do have any questions or you do have any other things to talk about, please, our doors are always open. We have a helpline, and you can easily access us on social media. And once again, thank you very much, Dr. Sapong. Thank you very much, Dr. Eloka, for a wonderful session. And we look forward to future sessions with either of you. Thank you.
Thank you. Thanks, everyone.
Thank you. Thank you.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.